Hello, everyone, and welcome to this session on the youth in Africa, digital health and connectivity. My name is Dr. Eno Awa George Stevens, and I am a youth representative for the Lancet and Financial Times Commission growing up in the digital world from Africa. And today I'll be chairing this session with Dr. Flavia, who will also be coordinating this panel. And permit me give a brief overview about this session before we go into the panel discussion. The Lancet and Financial Times Commission Governing Health Futures 2030, Growing Up in a Digital World, explores the convergence of digital health and artificial intelligence with universal health coverage, focusing especially on improving and safeguarding the health and well-being of children and young people. Multi-stakeholder dialogue hearings are a central piece of the Commission's work, bolstering meaningful interactions between the digital and health sector. Representation from countries with the highest youth populations must be involved, many of which are in low and middle income countries located in Africa. These representation could include government, civil society, and youth representatives, industries such as the tech, startup companies, academia, and development agencies active in our region. Our commission was set up in 2019, in October 2019, and it explores the convergence of digital health and artificial intelligence with universal health coverage. The Commission brings together 19 independent commissioners from a range of sectors and disciplines, as well as being geographically diverse and gender balanced. And the objective of the Commission is to deliver a clear set of recommendations on the governance of digital health, taking full account of geopolitical, economic, and social factors. The final Commission report is scheduled to launch in October 2021 at the World Health Summit in Berlin, and we have already submitted the final draft. The report focuses on the digital transformation of health, youth, health futures of growing up in a digital world, as well as ways to. The Commission also works on youth and focuses on Africa for digital health and connectivity. We understand that for youth to truly have agency with respect to digital technologies and approaches for which they are intended end users or beneficiaries, they need to meaningfully participate beyond just being loosely engaged in every step of the process. In 2020, the Commission conducted a study in 10 African countries with young populations. And the countries were Cameroon, DRC, Ethiopia, Liberia, Malawi, Mali, Niger, Nigeria, Tanzania, and Uganda to better understand national priorities and activities for strengthening digitally enabled health systems, barriers to implementation, and the extent to which the needs and views of young people have factored in these at the Africa Health Agenda International Conference in March 2021. The study found out that every country strategy has a strong emphasis on strengthening integrated health information systems. In so doing, the goal is to improve data collection and use for decision making and outline plans to use telemedicine, mHealth, and or eHealth tools to improve quality and increase service coverage, especially for underserved population. None of the digital health strategies included in the study gave consideration to the particular needs and views of children and young people. All the 10 strategies recognize the need for a stronger governance of digital health and data. In the spirit of innovation and inclusivity of diverse youth voices, the co-chairs and commissioners advocated for a holistic and strategic approach to engage youth in the Commission's work and to support structures that amplify their voices and encourage youth as agents of change, agreeing that the involvement of youth in digital health decision-making spaces is key to positively influencing youth in digital environment. The youth team works to drive the youth agenda of the Commission and also looks at the wellness and issues affecting young people which are defined by themselves. The youth team is composed of young leaders. I am the youth regional representative for Africa, and coming from Cameroon in Central Africa, I try to bring the African perspectives of challenges young people face in digital health and connectivity. The youth team is currently working on the onward-facing youth strategy of the Commission and the three strategic objectives that I would like to share with you today. First, the Commission conducted a global consultation in Wilton Park to get answering at the questions: what do youth want to see in the future of health governance? The consultation brought together 26 young people from 23 youth networks representing 22 African countries, with Africa fully represented. The Global Youth Consultation led to the co-creation of a youth statement and call for action that will be published alongside the final report later this year. We hope to lead more youth consultations in the near future that will focus on particular regional needs and would be great to connect youth present today who are interested in joining. Second, future opportunities to lead in the report destination will be shared later this year. We are already looking ahead at the next phase of our work, including research with and for youth that will look at the impact of digital transformation of health and well-being of youth over time. Thirdly, a great way to get connected is by joining the Governing Health Futures 2030 Youth Network. We encourage all young people, especially in Africa, to join the network by checking out our Twitter page at Governing Health Futures 2030 and following the link to join. The network is a great way to hear from young people with shared values on what the future of global health governance aims to achieve. The network offers a great way to share experiences, learn of future opportunities of interest, and to join in the work of the Commission, including areas of possible research, advocacy in the report findings. We will be launching a Facebook group for the network in the near future that will aim to create a platform for youth members to share knowledge and opportunities of interest in relation to health governance. I look forward to connecting with you directly. And in today's session, we'll be looking at youth in Africa, digital health, and connectivity. And at this point in time, I would like to hear from the coordinator of this panel, Dr. Flavia. What do you think is the role of young people within digital health and connectivity, especially in Africa?
Thank you very much, Dr. Stevens, and good afternoon, good morning to everybody. As Dr. Stevens said, my name is Dr. Flavia Senkubuge, and I'm a specialist in public health medicine based at the University of Pretoria. Dr. Stevens, I think this is a very important question. I mean, there is no doubt that the fourth industrial revolution has long been on its way into the mainstream healthcare, from using drones to deliver medicine to advanced e-health technology. And what COVID-19 really has shown us is the fact that technology is needed in all sectors, and for ourselves, it is certainly must be deeply embedded in our work and practice in healthcare. And there is a WHO framework called the Youth-Centered Digital Health Interventions. And I think through that particular framework, one of the key issues that is quite important is around the guidance, the planning and interventions for young people. And certainly one of the things is that the role of young people has got to be front and center in terms of, one, articulating their needs. It is difficult for us as people who are older and who are specialists to dictate to young people what exactly they need. And I think the role of young people, one, is that what you have been talking about this whole afternoon. One is the issue of advocacy and articulating quite clearly what the needs are of the young people. I mean, it would be remiss of me not to share experience, for instance, in terms of, as a doctor in the academic setting, how we had to transform into the digital space and ensure that we have online learning during the COVID-19 pandemic. But having said that, not all our young people had computers, not all of them had access to data, not all of them had access to Wi-Fi, and even those who did, Wi-Fi was not always stable. And so one of the things is, one, the advocacy. Two is around us in terms of demanding the funding of this essential good for young people. I think this is something that is so critical. It's no longer a nice to have. So for instance, social media platforms and applications. For instance, if you look at during the COVID-19 pandemic, our young people, for instance, accessed, services that assisted them with their mental health and mental well-being through applications. And so in essence, it's no longer a feel good, you might or might not want to do it. It is something that is essential. For instance, if I make an example of our mental wellness of our students, for instance, we had apps there where students could do yoga, could for instance, we had a program where one could go in and pet a dog and things like that, and we moved it over to an online platform. And also, I think, interaction with lecturers and that. And so I think in terms of providing for computers, Wi-Fi, routers, and all of that in a digital space, it's becoming very important. The other thing, of course, as young people is to allow and make it acceptable for young people to be at the place where the policies, as you were saying, Dr. Stevens, where the policies and the decisions are made. So nothing about the youth without them being at the table. And I strongly feel that it is important, whatever engagement we have, that we must include young people in terms of the discussions when they occur, whatever or however high that table is. Young people must be at that table when the decisions are made around digital health.
Thank you very much, Dr. Flavia, for that input, and I completely agree with you on that. And I want to hear from Dr. Roger. What do you think is the role that young people can play within what Dr. Flavia said? Do you have any input to that?
Yes, thank you very much, Dr. Stevens, for that. I think now we are in the world that is leading by the digital technology, and you see that the more connected people from the population, even in Africa, even in the remote area, is youngest people. So what we have to think about is how to use this connectivity, how to use the digital knowledge to help them improve their health, because there is a gap here. And if we try and we succeed to find a right solution, a right digital solution, or a right technology to link them to the healthcare system, I think we can do a lot of things. So that's my comment regarding this point. Thank you.
Okay, thank you very much. And I'm eager to hear what Dr. Angela is going to say. Dr. Angela, you have the floor.
Hi. Yeah, I think it's definitely something that we, as an older population, I guess you could say, we tended to neglect. And definitely, as Dr. Sengabuge said, we've had to learn rapidly during this COVID situation, and it's brought a lot more to our minds as to what we actually have to focus on. It's vital going forward that the youth have access to all of these medical platforms, even if it's just a medical learning platform. But even when we are talking about actual contact with doctors, possibly for consultation in, we've come to this point with COVID times that sometimes doctors are not able to actually have that patient contact, and we need to have a look at the digital world to be able to solve that problem and have online consultations. I think it's absolutely vital.
And yes, I completely agree with you. And I want to find out from Julian, Dr. Julian, what steps do you think we can take or stakeholders can take to meaningfully engage young people in digital health and connectivity? Because I agree that they are the ones using the digital technology. They are very active. And we agree that in Africa, more than 60% of the population in Africa is made up of young people. So what steps can you think the government can take or stakeholders can take to meaningfully engage young people within digital health and connectivity?
Thank you, Dr. Stevens, and thank you to the previous speakers. So in response to your question, I would like to reiterate what Dr. Senkubuke just mentioned, and she said something that's very important. I work a lot with adolescents and young adults, and who really comprise the youthful population. And one thing that you learn is that you cannot, have a sort of like a push down approach for when you're designing interventions for youth, or when you're designing anything that is supposed to work for the youth. So one very important step that Dr. Senkubuge mentioned was involving the youth right from the design of whatever it is that you plan to do with them. So if you want digital technology for health, you have to get the adolescents involved. Another thing is, making it appealing to them. We've noticed that in the recent, past decade, technology from social media to all types of technology has been evolving to appeal more to the youth. Before, we used to have SMSs that were just basic. Now we have, videos, we have GIFs, we have TikTok. People are, so the technology is moving towards appealing to the youth, being more graphic, being more entertaining. So I feel like the two things I would say is, one, involving them right from the start, and then two, making technology appealing to them. So then they can take it in and embrace it. Thank you.
Thank you very much, Dr. Julian. This makes me remember the study we conducted in 2020, where we're looking at the digital health strategies of African countries. We looked at 10 countries. And it's interesting to note that none of these 10 countries had a focus on young people. Indeed, they looked at how to strengthen health systems and digital health technology, but none of the health strategies focused on young people. Do you think there is a need for government and stakeholders to focus their digital health strategies on young people? I will turn to Dr. Flavia. What do you think about this? In Cameroon, in DRC, in Zambia, none of them had a focus on young people, yet they're the ones using the technology. What do you have to say about this?
No, Dr. Stevens, you're totally spot on. I think traditionally, we can't in Africa talk about any intervention without talking about our cultural mindset. And I think we've always had the cultural mindset of young people should be seen and not heard. And that's the first thing. It will take the change in mentality of younger people, and people who are a little bit older, who believe that the voice of young people is critically important. And then for our younger audience, our engagement with people who are in governance, who are the policymakers, you need to come in, while being respectful of those traditional ways of engaging the older population. Otherwise, you won't get any of your messaging heard, and so that's number one. We cannot divorce how we engage from who we inherently are. And as philosophical as that may sound, that is very important. In my classes, I teach my students around policy engagements in different spaces and in different areas. For instance, as much as I am a woman who works in a space, I'm a medical doctor and everything, there are places where I cannot engage in Africa as a woman. And so I have to lean over to my male counterpart to say medical male circumcision is one of them and bring them in. So we cannot run away from that. And so one is around engaging within our cultural context. The second one is around the recognition of the fact that it is true, Dr. Stevens, that we can't dismiss the fact that when we talk about digital technology, in particular in the African context, we're really talking about access. So you have to frame the issues quite clearly. And I think we can't run away from the fact that we're talking about accessibility. I mean, last night at the opening, the Honorable President, His Excellency Museveni, last night quoted the Honorable Julius Nyerere, who said that while the rest of the world walks, Africa has to run in order to catch up with them. And so you have to frame that quite clearly, the data costs, the lack of access, the Wi-Fi, and all the things that I've talked about. And so one, in terms of engagement, you need to be clear, what are you engaging on? The second thing is that you do need a partner. There are many of my distinguished panelists who work in that area. Bring them along, tell them, these are the things that we are struggling with, and can we please go to our government and whoever together, so that we are not going as a begging bowl, but saying, these are the things that we can offer. I don't want to be remiss, Dr. Stevens, by saying African young people are very innovative. We have got to, as governments and older people, fund these innovations. And so a lot of the digital health technologies that we are seeking are not from outside. They are things that our young people have invented. And so we need to create for them a safe space. For instance, if I look at our University of Pretoria, we have what we call the maker space and also incubation spaces, where the young people's innovations, we incubate them, they work with eminent scientists, and then we can even scale them up to market. And so we need to adopt those kinds of things that where young people will be able to be protected and the innovations have to be protected, because there are many things that are going into digital health innovation and technology, issues of intellectual property that young people may not really know. But if we create those safe spaces in our institutions of higher learning or in our different spaces with a number of people that I'm sitting on this panel with, it will be much easier for our young people to speak to those particular stakeholders. So mentorship, I cannot put the mic down without talking about the issue of mentorship. Those who know should bring along young people and say, I love your idea, I do know, and open those doors for young people, because a young person will not always be listened to. But for yourself, who is sitting on a particular seat and table, who already has a seat at the table, please ensure that we break those silos and those norms of leaving young people behind and bring them along.
Amazing, Dr. Flavia. And this brings me to another question, which you said. I want to find out from you. You spoke about this intergenerational gap between the old and the young. I want to find out from you, how do you think this gap can be bridged? How can you bridge this intergenerational gap between the old and the young?
It has to be intentional. We cannot just talk about it. We have to put programs in place, and it has to be intentional. So we have to create frameworks. For instance, mentorship program, as I shared with you at the University of Pretoria, we have intentionally in our whether it's an assignment to our students and that, innovations as part of their work. So it's no longer just, write this essay and bring it out. We say to you, solve this and this and this. And then, we believe these are the top 5 people, and then take them into an incubation phase and then intentionally scale up. That's number one. It has to be intentional. 2, we have to fund it, because as much as we are intentional about the work that we are doing and we are mentoring people, nothing will happen, and those particular innovations are not going to be scaled up until we fund them. We have got to release the funds, and intentionally, whether it's in the department, many of our countries have got, for instance, ministries of women, youth, and whatever. So people like you, Dr. Stevens, need to engage those particular ministers to say, where is your budget item for digital health for young people, as much as we've got all these other budget items. So we have to get away from the mindset of let's only fund youth programs or, health and wellness and all of that, but understand that our young people are also vibrant, dynamic. And so we need to articulate that clearly there must be a line of funding in our ministries of health and innovation, digital health, whatever it is that we want to do, because our young people are that good. I really believe so.
I definitely agree with you, Dr. Flavia, that funding is a very important tool on this. Now, I would like to go to Dr. Angela. Now, I want to find out from you, what do you think in terms of digital connectivity for young people? How does this affect economic growth and development? Why is digital connectivity for young people so important in terms of economic development?
Economic development, I think it completely bases on just how much connectivity we can have. Our youth is the future of every economy. And if they are not having that digital connection, then they are really put on a back foot as far as progress is concerned. We, as an African continent, we are often considered to be behind those of our European and American counterparts. And this digital health connection and having those platforms available are one of the main reasons for this. We don't have the networks within Africa. We don't have that connectivity that other countries have. And unfortunately, it really puts us on a back foot. And for me, I think it's vital that we get those connections going. And as Dr. Flavia said, it's really important for that mentorship, for the youth to be able to get in contact with mentors, to be able to advocate for this kind of thing, and the funding. You can never get away from funding, right? Because everything costs money. So I think economically, in order for each country to be able to grow economically, us being able to get on that footprint, that data footprint that's actually really needed, it's vital. And without it, we're not going to have that economic growth that we see in our counterparts.
Thank you very much. And I look at those in the rural communities, especially in sub-Saharan Africa, who have a serious problem in terms of connectivity. What about them? How do you think their voices can be heard, young people in rural communities? How can they be brought to the table?
Right now, they can't be heard. To be honest, the only way that their voice is heard is by some of us going into those communities from time to time, seeing the concerns and having that contact with them. Unfortunately, that at the moment is the only way that they experience any kind of contact and that their voices are heard. And it's one of the most important things that I feel need to progress in those rural communities, to give them that access. You talk about economic development, especially in the rural areas. Having knowledge of what is happening in the outside world and the progress that is happening and what is happening in your own country is vital for your own personal progress and development. And we're relying on that youth coming through in the future generations to be able to progress in the country, right? It all starts with a bricklayer. And if your foundation isn't really solid, then we can't expect their futures to bring to light the amount of potential that they actually have. And definitely the rural communities are the hardest impacted, where their voices are not heard, their concerns are not heard, their own personal development is not happening because of a lack of that connection with the digital world.
Thank you very much. Roger, I want to hear from you. Coming from a French West African country, what would you have to say about connectivity in French West Africa, Mr. Roger?
Yes, thank you very much. I think the situation is not different from the other sub-Saharan African countries. The connectivity is very poor in the remote area, in the remote countries. And I think the government has to put effort also regarding this to allow a better access, because I think that it's something that is very cheap now to have the connectivity access. And for me, one of the biggest solutions will be maybe through the smartphone, because you notice that even in some village or even in the remote countries, young people can have a small smartphone, and if the government put an effort by reducing the price of the internet connection, I think this can increase the numbers of people acceding to the digital technology, and by then they can use a kind of application or this to develop. So I think we have a lot of job, and the government have also to put this forward. Yeah.
Thank you very much for that input. And now I turn to Dr. Julian. We are in the COVID-19 situation, and I think it has brought much negative impact in terms of access to digital connectivity, especially in sub-Saharan Africa. What do you think has been the effect of COVID-19 on digital health and connectivity, both positive or negative?
Well, thank you for that. Sometime later this year, I'll actually be carrying out a study and looking at that data among youth in a rural community in Uganda, where I work in southwestern Uganda. So COVID-19 in terms of health made us realize that there's a lot of infrastructural barriers to health provision. We've seen situations where there's total lockdowns and patients weren't able to come into clinics. I work in a chronic care clinic, in an HIV clinic for adolescents and youth. So patients weren't able to come in. And then later on, when these lockdowns were kind of relaxed, there was still prohibitive transport costs. There was still fewer doctors within the clinic, fewer counselors. So basically, COVID-19 made us realize that digital health is very important. That digital health will bridge those infrastructure barriers of transport, absence of the clinician, like a formal presence of a clinician, in that, your phone would be ringing off the hook, patients asking you, so I am out of medication, can I go to the next clinic? Also, I took this medication and this is a side effect I had, what can I do? Or I had this baby and this baby is preterm, what can I do? And then you like count the breathing rate. So this just made you realize that, COVID-19 just kind of brought out what we already knew existed, but kind of, just kept on the down low and never acted upon. So it made us realize that digital health is the way to go. Digital technology in just health provision is the way to go. Some of the disadvantages, like I would say, before I go to the disadvantage, I would also just like to reiterate that what was said earlier on in terms of mental health. COVID-19 was a time when we were locked up, was a time when we couldn't reach out to our loved ones, the time when we couldn't, travel. And we strongly relied upon just having, a cell phone, just having a Zoom call, just having a call just for your own mental health and sanity. Personally, I was locked up in Kenya for 6 months, and that was the only way I could communicate to my children. Then when you look at the negative side, I will say I'm still having like addiction to social media because of COVID. So I find myself, looking at my phone every other time. I find myself having the need to go online. And so the positive is that it made us realize that there were infrastructure barriers and we needed to overcome them with digital technology. It made our mental health bearable during the lockdown. On the negative side, the addictions, and sometimes the digital technology is not, is when not regulated, can pose a threat to especially the younger people. When you go to Instagram and you're looking at people looking a certain way and you look a little different, it may impact on the way you view yourself. So I guess there were positives and negatives, but I like to pick the positive, and that's why I'm carrying out this study later in the year. Thank you.
Thank you very much. And also working with young people, adolescents, I know that one of the major factors in terms of their health is sexual and reproductive health. What do you think is this convergence between digital health and sexual and reproductive health for adolescents, especially in Africa?
Actually, when I was coming to attend this, I had a bunch of, I did a bit of reading and, just looked at what is out there, what people have done in terms of digital health and promoting sexual and reproductive health in younger people. So there's been a bunch of studies that, that have explored what digital health might help with sexual and reproductive health in terms of just sharing information, making information readily available. And apart from that, in terms of just having a person to go to that might know better that might know better than you, like an older person who's been through this, and you're trying to ask, these changes. Can I use a condom? What can I do? Is Plan B available? So just having that information available and having someone to reach out to. Some time ago, like a long time ago in Uganda, in the university where I work, there was this study that looked at, it was called Cyber Senga. A Senga is, someone who gives you sexual reproductive information in our cultural context. So this person had a virtual kind of sexual reproductive health, like assistant or person giving out information to younger people. And this group of younger people, at the end of the follow-up, were found to be more knowledgeable, more assertive about their sexual and reproductive health rights, and did better in school. So digital technology does bridge that gap that parents might not be able to feel, things that we are shy to talk about, with our parents. So having access to this information and having access to someone who might help you in a time when when you can't discuss with somebody else is very important. Thank you.
Okay, thank you very much. To our dear participants, the Q&A session is there. If you have any questions, you can write in the Q&A session. So during that moment, we'll be able to answer to your questions. So the chat box is there. Just go to the Q&A section and put in your questions. I see there are a couple of questions there which we're going to answer 30 minutes to the end of this panel discussion. Now, I want to turn to Dr. Angela. We have spoken a lot about connectivity in sub-Saharan Africa and the role of young people. And there is still this gap in terms of digital literacy. Young people don't know or don't have that know what it means to be in the digital world, or are they safe to be in the digital world? What will you say in terms of what will you say is what young people should do to have more knowledge on using digital devices, on going online, on being on social media? What advice would you give for young people in that direction?
So this is it's a little bit of a catch-22 subject here, right? Because we're talking about increasing knowledge in the digital world for young people, but we're also talking about that access and how do you increase your knowledge on the dangers of social media and that kind of thing when you have limited access. But I think what's really important is that young people, it's vital for them to be able to access the internet. And companies like Google have put in place certain restrictions, I guess you could say, for the younger generation. This as parents is something that's very important. There is a Google specifically for under 16s, I guess you could consider. It's a PG version of Google. And if they happen to Google something that might bring up some very awful stuff, I guess you could say, it's blocked, right? So that's number one. But I mean, this problem goes so much more broader than just the dangers of something like that kind of social media and Googling things and trying to learn, because that's the whole point, right? We need digital access to be able to increase our education. And unfortunately, there is a very dark side to the internet and what's really available out there. I think as adults, we can guide the youth as to what to use the internet for learning platforms. And to try and educate them that social media kind of has two faces as to what's really happening and what is being shown on social media. But I think us as mentors, we really need to guide that learning and that digital world, and to try and advise our youth where to go and learn. There are plenty of platforms. If we're specifically talking about medical platforms here, there are learning platforms for the youth that they can go onto. Most of us, even this, is possibly open for the youth to be able to join in, to learn about healthcare, to join in on those free webinars that are available. Myself and Roger, we regularly host webinars on various health topics at SISMEX, and those are freely available for everybody to access, to be able to learn and increase their knowledge on very pertinent healthcare issues within Africa. But I think really from a mentorship point of view, it is us that needs to lead the youth as to what to actually use the digital world for, and to try and steer them away from the dangers that inevitably are there.
Thank you very much. Dr. Flavia, do you think there are any problems or dangers young people should be afraid of when engaging online? And also, I want to hear from you as a medical doctor. How have you used digital technology in connecting with your patients? Are there times where you use telemedicine, e-health, m-health?
Yeah, thanks, Dr. Stevens. I think there is no doubt about, as Angela was just saying, about the infodemia. And I think as much as, there's an appreciation, and Julia also said about this, that as much as there is an appreciation around the positive effects of social media or digital health technologies, there definitely is a danger. For instance, nowadays, you'll find that everybody has become become a quote unquote expert, whether it's in something small like maybe exercising, advice on nutrition and things like that. And somebody will just look and they will say, oh, in terms of your mental well-being, do 1, 2, 3. This is what has helped me. Or in terms of dieting and exercise, do 1, 2, 3. And you wouldn't have gone to your medical doctor to check whether that is, is good enough for yourself. For instance, if you find a young person who is diabetic and they are dieting all this time because they, have seen this on this wonderful app because the influencer has said this and they see the results. And as Angela was saying, in Instagram, there's this whole before and after, very convincing picture. And so our young people will obviously take this up. But I think that the issue of misinformation is something that, one, we definitely have to, from a policy level, have to regulate quite stringently. I think that it can't be just a feel good, this is where you should go to check whether this information is correct or not correct. I think we have to change in terms of our curriculums. In as much as, for instance, if I take our South African curriculum, in understanding during the time of HIV and AIDS, we certainly started in where during the new curriculum, a new subject called life orientation. And in life orientation, now children learn about HIV and AIDS, reproductive health, and all of that, which was very different from my time. I think it is important now within the curriculum to have something about technology, the dangers of internet and all of that, so that you learn it already from primary school, even if it's something that's a golden thread right throughout as part of the curriculum, because technology is here to stay. And the way we have used it at the university, one is around, as I shared, the mental wellness, that issue of one, mentorship in terms of checking in, how are you, and referring that particular student, how are you feeling? And they'll tell you, I'm feeling this, blah, 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 and you refer them to a psychiatrist or an appropriate professional, whether it is a psychologist. Number two is around also offering advice, kind of how to structure your day, because as my colleagues have all said, as all my colleagues have said earlier on, and in terms of being locked up and cooped up, not being able to go outside and, fresh air and all of that, it does wreak havoc on your mental health. And so the way we've used it at the university is to say, okay, we have to have intentional, once again, whether it's once a week or twice a month, to say, how is your structure going? You need to still wake up at the same time, 8 o'clock, then you have to exercise, then you have to study. Those kinds of things are very important. And one of the things that we have done, because I also sit on what we call the Health Professionals Council as a board member there, the South African Health Professionals Council has brought up guidelines of telemedicine. So in as much as it is important to have that access as medical doctors to our patients, it's still, you can't remove seeing your patient, examining your patient. And so it's important, we have then been able to draft those guidelines of saying, this is how far you can go, these are the parameters. And even then, although we lock down and all of that, if you see that these, particular symptoms are getting worse, you need to refer to somebody who's closer to the patient. So one, that even if we have telemedicine, there must be parameters, and you cannot remove the face-to-face way of functioning. And I think the other way again is around not only just when people are sick, but also how do we ensure that we maintain wellness and well-being of our students has been something for us at the university that's been very important. And also socializing. I mean, Dr. Stevens, we haven't talked about this, but it is important because a lot of our well-being is socializing. So for instance, at the colleges of medicine, in terms of we have what we call coffees with the president or coffees with whoever. And this is really get your coffee, sit down and have a coffee party, and chat about whatever it is that is going on. It's something that is very important for your mental well-being.
Indeed, Dr. Flavia. Thank you very much for that input. And I agree with what you said. Indeed, technology is here to stay. Now, I will turn to Dr. Roger. I want to hear from you. How can we mitigate? How can young people mitigate the problem with misinformation? You know, even with the coming of COVID-19, there was a lot of misinformation about the virus. You know, there were myths about the virus. Also, with the vaccine, there was a lot of problems about the vaccine. And what do you think? What is the role of young people in mitigating this misinformation, these problems of misinformation we have all over Africa? I know in Africa, misinformation is a great problem, especially with the COVID-19 pandemic. What do you have to say about that?
Yeah, thank you very much, Dr. Stevens. I think it's a question of education. We have to educate the young people about how to use, as you previously said, what are the procedure to use the digital technology, what are the boundaries that we put towards social media, and how do they use this gift that is the technology, how do they use this properly for advancing the healthcare ends. And with Sysmex, what we try to do is, first of all, as Dr. Angela says, is to use a lot of educational platforms. So we use it for all the population. They can log in, they can follow. Even for the COVID-19, we had a lot of webinars regarding this for people to have the good information, and whenever they want, they can connect into this platform to get to have this right information. And each time that we are going to an hospital, that when we are going to an healthcare facilities, we try to educate physicians, because they are the ones who sometimes, the pediatrician, for example, they are the ones who are face to face to the children. So we educate them, and we count on the fact that they will relay our information to the young people, or or to the children. So we took each opportunity for education, for better education, to all the people, and also to all the children in all the healthcare facilities. And we bring sometimes the new technology. For example, we are talking about children. You know that malaria is the highest burden, even in Uganda, towards children. And we have the new technology that can allow to diagnose very early, and to monitor the treatment efficacy. So we think that by promoting this kind of news, of good news, and also by sharing our experience, and by raising our voice high, we can have people with better education, and then they can know how to deal with this kind of wrong information. Yes.
Okay, and I remember what one of the panelists said, that young people are very innovative. They're very innovative in terms of innovating digital solutions. Now, do you see a future in in telemedicine, in e-health? As a medical doctor, do you see a future in that? Dr. Flavia elaborated and said that though we can move with digital health, with telemedicine, we cannot forget the physical aspect of it. As a medical doctor, if my diagnosis or my consultation is not complete without a physical examination, I think so. So, what do you have to say about that? Do you see a future in telemedicine, and how can we bring this convergence between the physical aspect and the virtual aspect?
I'm totally agree with you. I think we have to find the best fit. Because I will take an example. If a children is in a rural area, he do not have access to healthcare. And if, for example, with some one symptom, for example, with fever, the doctors can talk with him through a digital platform, see, look its face, do the inspection. I'm sure you are right. He cannot do the palpation and the physical aspect, but with the symptoms, he can. I think he can try to give the first aid, and maybe the first drug, and the first help for the children to be able to go to an hospital, maybe for the the next hospital and to meet a physician. So I think we are in the perspective where we face a lack of physicians, we face a lack of healthcare facilities, and I think for me, the digital can be a first step, even if it does not go further in the investigation, but it can be a first step to orientate the patient. So that's my personal point of view.
Thank you very much. And I turn to Dr. Julian. You're working with young people and adolescents. What strategies do you think stakeholders can take or the government can take to integrate digital health within the educational curriculum? I think you agree with me that integrating digital health technology or digital education within the secondary school curriculum is important. So what strategies do you think the government or stakeholders can do to integrate that?
I mean, growing up, we did not have access to even just smartphones. We did not have access to even computers. I had my first Facebook account when I was 14 years and in high school. So the first thing that government should do is give access, give access in terms of schools having access to even these devices or these digital, technology devices that will be used. Then the second is just, reducing the cost of internet, and that still has to do with access. So, reducing prohibitive costs. In Uganda currently, people have to even pay taxes to access social media, which is a story for another day. But that alone, it just makes it difficult for this curriculum to be, implemented. So in as much as we'll write it down in the curriculum, we'll write it and spell it out nicely that, we want children to have, a digital learning or digital health as part of their curriculum, goal. At the end of the day, if there's no access, if internet is still prohibitive, then it is something that you cannot implement on ground. Then two, we have this notion that digital technology is all bad. So we have to start by, rewiring, first of all, our leaders' minds, our parents and the older persons, that digital health is not bad, it is actually the future. So that change of a mindset will, one, allow us embrace that people who make these curriculums are older persons who probably did not use internet that much or did not have digital access that much. The world is moving forward and perhaps they are not moving along with it. So just rewiring people to think that this is not all bad, there's actually very good that can come out of it, are one of the steps. And then as usual, we've said money, money and money again. So there's nothing you can do without money. Most of the schools here are government funded schools. Most of the good schools are government funded. So if the government is not pouring money and putting it in part of its budget lines to have these items purchased, these teachers who are actually trained in digital technology, offering the curriculum, offering the teaching, then we can't move forward. So that's what the government can do, give the scholars, give the schools access to the gadgets themselves, access to technology. And then, we need to just change our mindset, and then I think we'll embrace it.
All right. Thank you very much. And at this point in time, I want to move to the Q&A section, but eager to find out from any of the panelists if you have something to say or to input on what we have been saying. Maybe I didn't touch on one of your points. Maybe you want to include it. Dr. Flavia, yes. Dr. Angela. We cannot hear you. You're muted. Can you please unmute yourself?
There we go. Talking about digital health and education. So I just want to say that the panel has been, I think, very informative. And I think we've also raised a lot of issues that need to be brought to the forefront and solved as much as we can. And I think it involves a lot, like myself and Roger from industry. We are a company and we do as much as we possibly can at Sysmex to help bridge that gap in digital health, to do things like the webinars that we've been saying, to do things where we specifically educate. Myself as a scientific manager, I have my company side, but at the same time, I do webinars and presentations for universities. We had a COVID webinar that I did specifically for Venda University to try and educate the youth on vaccines, for example. Those kind of things, I think that there is a gap between where people are able to find those webinars or know that they're actually happening. And I know that it's one of the questions in the chat box. And I'm sure Roger as well. I'm personally happy for anybody to email me, and we can share academy links and also share portals where the youth may go to find those webinars, to find education points that they can go to on health topics that are very, very important. Especially something like for myself at the moment, I'm very deeply involved in the malaria situation and in Africa, and there's quite a crossover at the moment between symptoms with malaria and COVID-19, unfortunately, and that increases the burden on the healthcare systems of people not being educated enough to know that you can't misdiagnose, just assume that it's COVID-19, and then you have patients that are dying of malaria. You know, we can't have diseases that go missed because of misinformation. So I guess what I'm basically getting at is I certainly put my own hand up for anybody to contact after this panel discussion to get links to be able to get onto those webinars and those education portals. And also you will be able to go and watch previous webinars, that kind of thing. So I just put, that's just from my own personal aspect for me to be able to say that myself and Roger, we can definitely share for anybody in the discussion who wants to know where to find those kind of webinars and that kind of thing. And not just Sysmex based, there is centralized portals where multiple key industry people have got webinars listed for people to be able to go and watch. Obviously, that is then for people that have that are more fortunate, that actually have access to those digital portals with internet and the connectivity to be able to do that. But it is a small part because industry does need to play a role in this, in the digital world, and making that connection for everybody to have access.
All right. I see Dr. Flavia has turned on her video. Dr. Flavia.
Yeah, I wanted to say, I mean, what a generous offer that is being offered by Dr. Harrison and also Dr. Asimen, and that sort of answers Dr. Stevens, the question in the chat about how to become, you know, an advocate. That people, we are always talking about this advocacy. One of them is definitely to attend. I mean, it's always just so heartwarming to hear colleagues like Dr. Harrison and Dr. Asimen giving of themselves in this way, because in order for you to advocate for something, you need to be able to be empowered first and know the conversation, know what is out there, what are we discussing. I always say that I have now, you know, in this time, started differentiating between positive advocacy and toxic advocacy. And a lot of the time, toxic advocacy is when you don't know, but you are just looking at the trends and the hashtags and you just band yourself with that and you go along. But if you've got people and colleagues who are so generous, like Dr. Harrison and Dr. Hasman, go and educate yourself first before you can become an advocate, because from there, you will be equipped with the knowledge of what kind of conversation, when you've given a space to sit at the table, what kind of conversation that you're supposed to have. So I can't tell you how excited I am to have colleagues who are so generous.
Indeed. Indeed. Dr. Julian, do you have any input before we go to the Q&A section?
I mean, we were talking earlier on about, you know, Dr. Asiman was talking about when you asked him what he thinks about digital health being a standalone. I think for me, in conclusion, I would say we should not look at it as something that stands on its feet. It is an intervention, but still the physical still calls, and we should just look at it as an augment, something that augments physical care. And then even then, in terms of the digital health interventions that we have, even while they're like formal, like there's this application that people will go to, young people will go to get information, or young people will run to get access to whatever it is that they want to have. There's always this informal exchange that happens between healthcare providers and the youth in terms of promoting their health and helping them, go through these different changes in their lives in terms of health provision, with chronic care, acute care. So my 2 points really to take home after this, what is that digital health is not a standalone. It augments our routine physical care, and we should keep that in mind. Even as much as we talk about it here, it shouldn't be a replacement for. It is something that stands along the actual physical health. And then the second is that even as we try to package it as something that's very formal, digital health does go on informally in very many aspects of our healthcare provision. And those two is what we should always bear in mind when we're talking about digital health.
All right. Thank you very much for elucidating those 2 points. And now I'll move to the Q&A section. And any panelist who is inspired to answer, you can just unmute yourself and answer the question. So I will take the question from Humphrey Beja. Humphrey Beja says, I've heard of advocacy. How is this possible? Where can a youth like me begin from? A youth might feel young and not empowered, having less confidence because they are not guided on the path to follow. So, what path must a youth in a very low resource setting and at the grassroots level follow to engage in advocacy? Maybe I would just go around the panel and hear your thoughts about this question. Yeah, Dr. Julian, you're unmuted. You want to start first? Oh,
Sure.
Dr. Okay, fine. Before Dr. Flavia, yes.
I mean, working in the grassroots for most of my career, I think that the first will begin. I'll begin by just having youth to youth. So among youth, just having these days that you might get together, maybe in your school, maybe in your community, just interacting with your fellow youth, and talking about, for instance, what's going on in the neighborhood, maybe what's going on in the country. And then you could move this a step further to youth fora that bring youth from different communities. So let's say you're in village A and you're talking among yourselves, then there's village B and people are talking among themselves. There's usually youth fora, at least from where I come from, that bring all these youth and make them interconnected. In terms of advocating, I would start by, for instance, it's hard to say that you start from your local leaders, but I would start from demanding that local leaders, one, first of all, like in Uganda, take away the taxes that we have to pay, and then two, reduce the taxes on, let's say, digital, gadgets that so making them affordable to you. So those are the ways, just getting together as youth and making your voices heard. And then once you're many, there's a power in numbers. So once you're many, you can move together in those large numbers, and then now approach maybe your youth leader in the community, or approach your youth minister, and then just say, we need to access this internet. We need to access this. I need to be able to get this computer. But the things that are prohibiting me are A, the cost of the internet, 2, the cost of the actual gadget, and then 3, maybe the taxes that you're putting on this, this social media. And then you can, start from there. But as an individual, it might be a little hard. So I would say start from one, forming little groups at the grassroots, having these meetings with your other youth. And then now with bigger numbers, you can then make your voice louder.
I agree with you, Julian. And I remember last year in Cameroon, where the government had to place tax on phones, on smartphones, that whosoever wants to purchase a phone must pay a tax for a phone, and that brought a lot of controversy. And I think sort of some of the resistance or barriers that makes young people not to access the digital world and connectivity. Dr. Flavia, what do you have to say about that?
I firstly want to say you're never too young at all. I have to I have to start off with that one. It doesn't matter. I mean, we've seen, for instance, with the young people who have driven the climate change conversation, they are so young. They are in primary school and they've driven climate change. So one, you are never too young. Secondly, I couldn't agree more with Dr. Adong in terms of looking at the community spaces, but get yourself a mentor. I mean, for instance, I have my mentees who have been with me since they were 19. They are now residents and things like that. And they've been empowered because where you can't go, your mentor will be able to advocate on your behalf. And so it is so important for young people to get somebody who is, a mentor to you. It's something that is critically important in your space to being an advocate. And I think the last bit is, I couldn't stress this more: empower yourself first. You can't just go there and say, I'm advocating for digital health. Listen to the things that Dr. Stevens has been talking about early on in terms of the work that they are doing, the reports that they are bringing, the research that Dr. Adong is a part of, the research of Dr. Harrison, and all the different things that Dr. Asimen has done. And so empower yourself, so that by the time, as I said, you get to the table, you are quite knowledgeable in terms of the topic that you will be discussing, or even the subject matter you'll be advocating for.
Yes, and I agree. Go for knowledge. Empower yourself. I totally agree with you, Dr. Flavia. Thank you very much for that answer. Dr. Angela, what inputs can you give about that?
Yeah, I think both Dr. Singabuge and Dr. Adong have they've definitely mentioned the most important thing, and I think equipping yourself with that knowledge is vital, because you can be an advocate and be misinformed, for example. So it's really vital that you do equip yourself with that knowledge. And as Flavia said, we have the youngest children, like Greta Thunberg, who has driven the global warming and situation. You definitely can never be too young to advocate for something, and sometimes the youngest voice is the one that we hear the loudest. The older that we sort of get, maybe we get a little bit, our shine is not so much anymore, because we're tarnished from being in the industry, from fighting the fight. And those young ones just have a passion that we maybe lose our spark a bit. And again, as Dr. Sengabuge said, make sure that you have a mentor. Having a mentor is vital if you want to be an advocate for something. We are able to get into spaces where you aren't. We have experience and knowledge that we want to impart on you. It's really, really important to have that mentorship, to be open and have discussions that are maybe sometimes uncomfortable. You must remember that any topic can be controversial, and there will always be more than one side to a discussion. So be able to speak with confidence within your youth group and within your set of people around you. Make sure that you can make your voice heard, but listen just as much, because we often learn a lot more by listening than we do by talking. And I think it's quite important for having those controversial conversations, and not not getting angry, being able to have those conversations that are controversial, and being able to listen to an idea or a opinion that is different from yours. But just by doing that, we will learn a whole lot more, and we will be able to advocate a lot better. So I think for myself, that is some advice that I could maybe impart on the youth, to go forward with. Equip yourself with knowledge, make sure you have a mentor, and speak with confidence.
Wow, great lessons there to learn, Dr. Angela. Now I move to Dr. Rogers. Any thoughts on that question?
I think everything is already said. I just take for myself two words: mentorship and education. I think that the summary of Dr. Flavia is really great, and young people have to choose a mentor, and then they have to educate themselves, to keep learning, and to try to be the best in the area. So I think that's the summary that I can make. Yeah.
Okay, thank you very much. Now, the next question is from Joy Nikesa. He says, we'll be grateful to find these webinar links for health dialogues in Africa. Kindly share the current keynote speaker's email. So this event is being organized by Makerere University and the government of Uganda. And I think that the Secretariat of the World Health Summit Africa Regional Meeting will be able to reach out to the various participants or those who require the email of the keynote speakers and panelists. I think it will be the place of the secretariat to provide that information if need be. So I'm sure you can write directly to the secretariat of this summit, the World Health Summit Africa Regional Meeting, to get the email addresses of the various panelists. Now, I want to turn back to the panelists. Any recommendations? I know we've been talking and talking and talking. Are there any recommendations which you think we should put forth to stakeholders, to young people themselves, or to the government? Any recommendations? I start with Dr. Julian.
To the government, that's but like Dr. Senkuge said, there's no voice that's too small. I would like to start of all, stating very boldly that the digital health is the way to go. And I don't think we're going to move backwards. It's just only going to go forward in the future. And two, that the youth, what Africa is going to lean on. I mean, if you look at the graphs of what they call the youth bulge, in 2050 about 30% of Africa's population is going to be aged 15 to 24, 30% of, I mean, it's stated that there'll be about 2.3 billion Africans in 2050, and 30% are going to be youth. So I don't know what these youth will be like if they don't have access to knowledge, if they don't have access to what is going on in the world. So I think that's the bold statement I would like to make to the government right now, that the youth is what is going to be holding the continent in the future. And we need to invest very heavily in these people. You don't want 2050 in Africa and we just have an uneducated, unexposed population that is actually running the government, that is holding the jobs, is the labor force. So I think on a government level, that is what I would say very boldly. And then two is to, for governments to just work for the youth. The people who are currently, in power, people who are currently are all going to die off, and there'll be a time when it will just be the youth, and government needs to invest heavily in terms of their health, in terms of their education, especially those two. Yeah.
Yes, thank you very much, Dr. Julian. And you remember, if you look critically in Africa, you'll see that most government officials use the digital world for their political reasons. I look at Nigeria, I look at Cameroon. Take for example, in Nigeria, there was a ban of Twitter. Twitter was banned in Nigeria. You can imagine the impact that has on the young people accessing opportunities and information via Twitter. In Cameroon, it was, in fact, social media, it was complete a breakdown of social media for about 2 months because of the elections and because of politics. So you see that the government can be using digital technology at the deprivation of young people. So I think you've touched on a very important point. Let the government work for young people because we need these platforms. We need to use these platforms for our health, for our benefits, to access the opportunities, and to get more informed. So thank you very much for those recommendations. Now I move to Dr. Angela. What recommendations do you want to put forth?
I completely agree with Dr. Adong that the government needs to work for the youth. And as you've pointed out, the government is able to control that social media interaction when it is to their benefit. So they need to make sure that that social media interaction is to the benefit of the youth and educating the youth. I feel that a lot what happens is government ensures that everything is in place when it comes to elections and what they need, and they manipulate it to the best of their needs. And I think that maybe a little bit of education on government side on how to make sure that you use that same power to get the education out to the youth. I know it's a little bit also in Ethiopia. They when it's exam times, internet gets shut down. And connectivity is restricted. And I mean, for business purposes, it's quite an issue economically, right? But it's to try and make sure that the youth use that time and not get distracted. So, but I think that it's a balancing act, and to try and find that fine balance where government ensures that it's being used and working for the youth and giving them that education with it. It needs to be a correct balance, that it's not just for their own use, but it's working for the youth.
Thank you very much. Dr. Roger, what would you want to put forth as recommendation?
Yeah, yeah, thank you very much. I think coming from the government first, what we can say is that they should hear the voice of the youth population. So they should put in place some platform to allow the communication between them and the youth population. We saw in the COVID-19, when the COVID-19 crisis began, that a lot of innovation came from the young people in the university, in the high school. They perform a lot of good things, even here in Ivory Coast or in the other sub-Saharan African countries. So we have to help them. The second step is the mentorship. You have to help them to go far with the idea, to go far with the innovation, and to help to improve all the healthcare system, because we are talking about health. So, and the last thing is to allow them to have a better access to the internet connectivity by reducing the tax. I think that was one suggestion from Dr. Julian. I think we should look at taxes on internet and reduce his taxes for allowing people in the remote area to get access to internet. So I think that this is my point for the summary and my recommendation. Thank you.
Thank you very much for those powerful points. Now I turn to Dr. Flavia, our day coordinator. What maybe you should come in at this point in time.
Thanks, Dr. Stevens. I mean, I have two comments, and really my recommendation is just one, because all of my esteemed panelists have said everything. In Africa, we have some of the smartest, brightest, and most innovative people in the world. I can say that with confidence because I'm in an academic setting and I work with these incredibly amazing young people. So let's not hinder them, but we must stay out of their way by creating enabling environments for them to flourish. And that environment is to ensure that they are technologically advanced, as all my esteemed panelists have said. The bottom line is the fourth industrial revolution has arrived. Yes, we are at various stages in the African continent, but we need to embrace it and use it to uplift, to improve, and to cater to the health of our young people, or even to the developmental agenda of our young people. And so I only have one recommendation. There must be a funding line in our budget that is going to be talking about technology. That is a non-negotiable. And I want to go so far as to propose that at least 2% of funding of the Ministry of Youth and that has because I did hear that we are going to be having a Kampala declaration. So I think our contribution from this panel should be that we need to have at least 2% of the funding that goes into the Ministry of Youth, as that 2% being or talking to technology advancement for young people.
Wow, thank you very much. Thank you very much. And from the Commission, we are having the Governing Health Futures Facebook group and network which we've created, which you can join. I could not share the link here, but on Twitter, if you go, you check on Twitter, GF, GHF Futures, Governing Health Futures 2030, you will get the link to join the youth network. Also, in June, we had a consultation with young people where we're looking at the problems they face in accessing digital technology. And we came up with the call for action and a youth statement, which will be published alongside with our report that's in October. And I think from there, we'll be able to continue networking with young people and see how we can bring more young people on board to bridge the digital divide and make them to become more aware of the digital solutions and technologies we have and how they can advocate more for their rights. At this point, I want to thank everyone for attending. Thank you very much to our dear panelists for your time, for your inputs, for all the recommendations you've made. And thank you very much to our participants. Without you, we wouldn't be here to talk about this very interesting and important topic, which touches young people in Africa. And also, thank you very much to the University of Makerere and the government of Uganda for organizing this first ever African Regional Summit in Africa for the World Health Summit. Thank you very much to my dear panelists. It's been a great time, and I look forward to seeing you in some other activity, and also to seeing that our recommendations will be taken into consideration. Thank you very much.